Hello, everyone. I'm just pulling up my slides and then we will be able to get started. Great. Hi, everyone. Thank you so much for joining today's webinar. My name's Mary McCaskill, and I'm a research director at the National Centre for Social Research, and I manage the national evaluation of A Better Start. So I'll be sharing today's session. Just so you know, there are subtitles available. So if you would like to use them, then at the bottom of the screen, you should see a closed captioning CC function. So go ahead and click that. But so we're here today because we are 3 years into our 5-year evaluation of Better Start. We start and we're looking forward to sharing some findings with you that have been emerging through our study. We started work in April 2021 and our evaluation will run until March 2026. And so we're a ways off from the final results, but we do have a lot that we're learning as we go. So we're going to be talking today about those findings, and also we'll provide links at the end to our more recent outputs if you would like to explore them in more detail. We have a full agenda for our hour together this morning. I'll start off with giving you a brief introduction to the national evaluation, and then I'll hand over to my colleagues in the evaluation team who will talk through the different objectives and the methods within them, findings to date, and next steps. Throughout the presentations, please could you use the Q&A function to submit questions and reflections to us. There's a lot of you here, so we'll monitor the questions that come through, and at the end we'll have a Q&A session where we'll respond to as many as we can with that when all the presentations are complete. So to introduce A Better Start is a large program set up by the National Lottery Community Fund to support babies and their families, for everyone to have the best possible start in life. It's being delivered through 5 partnerships in Blackpool, Bradford, Lambeth, Nottingham, and Southend-on-Sea. The national evaluation is being delivered by the National Centre for Social Research as the lead partner, but in close collaboration with a consortium of organisations, the University of Sussex, RSM, Research and Practice, and the National Children's Bureau. And we have colleagues with us today from NatCen, the University of Sussex, and RSM who lead on the research objectives. Research and Practice and the National Children's Bureau convene a practitioner panel and a parent panel, which we work very closely with to inform the evaluation. The national evaluation has 4 key aims, and they are to draw upon the evaluation objectives, which I'll explain in just a moment, and provide evidence for the primary audiences listed here. We provide evidence that can support ABS grant holders to improve delivery throughout the lifetime of the project. And we also enable the fund to present evidence from the national evaluation as it emerges to inform policy and practice. We work closely with the local ABS evaluation teams to avoid duplication, but also to support the collation of evidence that's generated through local evaluations. Our approach to the national evaluation draws on contribution analysis as a theoretical framework against which to analyze the impact that ABS has on the lives of families, on child development outcomes, and on systems change and the public purse. The evaluation looks to build a mosaic of evidence from these 4 objectives. So objective 1 is using health and education data to map change in child development outcomes of diet and nutrition, social and emotional development, and communication and language. It's doing this by comparing data from families living in ABS wards with families living in areas that are not in receipt of ABS funding. Objective 2 is taking a qualitative approach to looking at how ABS as a program is implemented in practice. We're doing this through interviews with staff within ABS partnership areas and also staff in similar roles in areas which don't receive ABS funding. Objective 3 works with a cohort of 25 families from across 5 partnership areas over time to explore and document how ABS is impacting upon their lives. And objective 4 is using cost consequence analysis to document the impact which ABS is having on public spending. Shown here are the steps involved in contribution analysis. So a better start is a complex program, and contribution analysis allows us to really lean into that complexity through creating this mosaic of evidence of different forms to evaluate the difference that ABS is making to the lives of children and families within the partnership areas. Here is the ABS theory of change that shows how the mosaic of evidence, represented by the squares, triangles, and circles, aligns with the different elements of the theory of change for ABS delivery. And I also want to say that that the theory of change, along with all the detail around the methodology that I've shared now, is available in the protocol online if you want to explore that further. So I'm going to hand over to the objective leads now, and their presentations really highlight how we're working with how the different evaluation questions and methods are working together to generate this rich understanding of the difference that ABS is making. And we're really excited by the findings that are emerging. So Enes, I'll pass it over to you now to share objective 1.
Thank you, Mary. Can you see my screen? I'm just double checking. Brilliant, thank you. Thank you, Mary. So in this section, as Mary said it, I will be covering objective 1 of the national evaluation, which is focusing on contribution of ABS to the life chances of children. As Mary said it, these are like, very brief description. This is a very brief description of objective 1. So let's start. So as I said, objective 1 aims to identify the contribution made by the ABS to the life chances of children in our partnership area. So specifically, we have this following research question: what is the average causal impact of taking part in ABS interventions on key outcomes for children under age 4 and their families in each partnership? So to answer this question, we design a quasi-experimental design that involves developing a comparison group and infers what the outcomes of beneficiaries would have been if the partnership had not been funded. In here, we have like a very simplistic graph or figure summarizing what we are doing. So first thing that we know where we are going to implement, where we have been implementing the ABS program. So we know ABS electoral wards. And what we did, we just did a area level matching to identify the comparison wards. After that, the individuals in ABS wards were eligible, well, they can get into ABS, they can access the ABS program, and the comparison wards, the individuals in the comparison wards, obviously they can't access it. So at the end of the program, we just received their health and educational outcomes. And by this way, what we are doing for our main analysis for the objective 1, we will estimate the average causal effect of ABS on key outcomes using individual level weighting approach. So this is like a very quick summary of what we are doing with objective 1. Now, obviously, for answering this question, for this research question, we would need data, right? So for that one, we had 2 options. We would either collect directly from beneficiaries and participants, or we would use administrative data to form the comparison group. And it has been decided that the data collection would not be feasible, especially data collection at a scale. Remember, we need to collect not only from the ABS wards, but we would also need to collect data from non-ABS comparison wards. And this is quite extensive work. So we decided that we should use administrative data for objective one analysis. So I will just go into what kind of administrative data that we are going to use in a moment. But for this administrative data sets, we sought consent from beneficiaries for the use of their data in our evaluation. And the important point also, we just sought consent to link their data with the administrative data sets. So the consent process was run by the partnerships, by each partnership, by each side from June 2022 to August 2023. The process was run by Blackpool, Bradford, Nottingham, and Southend. Lambeth did not run the consent process, as the Lambeth had already obtained the consent, the beneficiary consent for anonymized data to be collected and to be used for evaluation purposes. So we only run the consent process with our local sites for Blackpool, Bradford, Nottingham, and Southend. And in this table, you can see the number of consented beneficiaries by sites. And in here, I would like to emphasize that these are not the final sample sizes. The final sample sizes may be even lower, because it may not be possible to obtain the recourse for consented beneficiaries in administrative data sets. So these are tentative sample sizes for each site that we have at the moment. So while the number of consented beneficiaries was high enough to detect the meaningful effects in 2 out of 4 sites, in this case, these are Bradford and Nottingham, that was not the case for Blackpool and Southend. So that's why what we did, we have considered adaptations to plan analysis. Excuse me. So now I would like to talk about the methods that we are going to use the plan analysis. So obviously, we have different approaches for objective one analysis. So while all approaches use the same data sets, they may include different groups of individuals in their respective analysis. So the choice of approach is going to depend on the availability of data and the sample size or its statistical power. But our default analysis approach for all sites and outcomes is whole ward analysis. So what is whole ward analysis? In this approach, in this whole ward analysis approach, we will estimate the impact of ABS on outcomes of individuals resident within the ABS wards, compared to their outcome if the ABS was not funded in their area. So the key point, the important point with the whole ward analysis is that all individuals in the relevant population group in that ward will be included in the analysis, irrespective of whether they were directly participated or not. Given that this is a system-wide change, we thought this will be appropriate. So for example, we estimated that there could be like around 600 children eligible for ABS in one side, but the number of consented beneficiaries was around like 50 children. So you can see the drop in here. So this default approach is going to provide the largest available sample size for analysis, but this is not the only analysis that we are going to undertake. So we will also conduct additional analysis, such as pseudonymized beneficiary and consented beneficiary analysis, but these are depend on if we have large enough sample sizes, right? So for consented beneficiary analysis, as you can see, as you can understand from its name, we are focusing on the individuals who have given their consent, and pseudonymized is we are directly receiving the pseudonymized data from the sites, and I will just explore that in a minute. So at the moment, we don't know which approach will be used for each outcome. As I said, we haven't linked the data. We don't know the final sample yet. So the final decision on the analysis approach to be used for each outcome and each partnership will be made once we have the final sample sizes after the outcome data, administrative data linking. So I guess the question is where we are with the objective one then. So we have submitted our applications to NHS England and Department for Education to request data on health and education outcomes, as well as individual background information that we need for the matching and weighting. So we are expecting to receive the education data within few months. This is really exciting, but we are still working on the NHS data application, but we are quite hopeful that we will access this data later this year as well. So these data will be used for the whole ward and consented beneficiary analysis, and we will receive for both ABS wards and match comparison wards. And we are also receiving pseudonymized beneficiary data from sites, for example, Lambeth. This is the type of the data that we will receive with them. But with other sites, we are also exploring and we are progressing a lot on this one to the feasibility of receiving pseudonymized beneficiary data where the sample size is small or administrative data is not available. So we are just trying to create this whole picture by utilizing different methodologies. And finally, the next steps for objective one, we will obviously first finalize the analysis approach for each outcome and each site. And this is going to be, again, based on the data availability and the sample size. So this is our first priority at the moment. And then we are going to move on to the data preparation for the main analysis. And then we are going to conduct the main analysis using the statistical weighting approach. So I think this is all for the objective one. Back to you, Mary.
Thank you so much, Anas. And I'm going to step in to deliver the slides on objective two. Our objective two lead is a NatSen colleague, Natasha Phillips, and she sadly wasn't able to make it today, so I'm stepping in. As we said at the start, objective two explores the factors that contribute to improving children's diet and nutrition, social and emotional skills, and language and communication skills. We also explore systems change as part of objective two. So the aims of objective two are really to find out more about the how and the why ABS partnerships are making a difference to children and families' lives for the better. And we can see that through and we explored that through each of the outcomes in depth. It's important that we understand ABS implementation and these factors that contribute towards success, so that we can that it's possible to understand how to replicate good practice from ABS within services and also elsewhere, but also to be able to understand what's not working so that that can be reflected on and adapted. Everything that follows in this section of the presentation will be based on interviews that we carried out in 2023. So over the past year, we've carried out 2 waves of qualitative fieldwork for Objective 2, which have totaled to 39 interviews with staff working within ABS partnerships, either in the core ABS delivery teams or elsewhere, or for delivery partners, and that's shared across the 5 partnership areas. And we've also spoken with and we've also carried out a wave of interviews in non-ABS areas and with the fund. So going ahead. So we'll discuss each outcome area in turn, but there are also some common challenges that we're seeing across the outcomes, and also shared themes about what's working well. So I just want to touch on that briefly before we go into the detail of each outcome. So some common contextual challenges across the five areas, regardless of which child level outcome we're looking at, and I don't think this will come to as a surprise to any of you, are the ongoing effects of the cost of living crisis, where meeting their family's basic needs is having an impact on how parents engage with services. So, for example, families who are worried about meeting their basic needs around access to food or somewhere to live are less likely to have the headspace to give to attending a pregnancy support group or an early intervention speech and language drop-in. These are just some examples that we've seen in the data. We also can see the impact of stigma perceived by parents, especially in relation to targeted social and emotional support. And this came across more in these interviews than we had seen in previous waves, with some reporting that parents felt reluctant to attend services and because they were worried they would be thought of as a bad parent. And we'll talk about the approaches that ABS delivery partners are taking to kind of work against this and to make sure that ABS is perceived as an asset based and being the parent that and being a supportive program for parents to be able to parent the way that they want to parent and realize their ambitions for their family. So in terms of what has worked well in common across the five partnerships areas, what's coming through really strong are that positive working relationships between ABS delivery partners and the core ABS teams are really effective for making that joined up working between different organizations and teams able to deliver holistic family services. We also saw a lot of evidence that people value the personalized relationships that they have with the staff members who deliver ABS programs. So now in terms of the three child level development outcomes, what's working well? If we look first at diet and nutrition, early intervention is one area which our interviewees reported as working particularly well. So an example of this is the presence of support staff from an ABS infant feeding service on maternity wards. The role of a Better Start in establishing pathways of support through the infant feeding process from choices around newborn feeding through to the introduction of solid foods, and then later choices around healthy eating, was particularly welcomed. And since the last wave of interviews, some diet and nutrition services had also expanded their reach geographically. And this is partly in response to the cost of living crisis and also to cover areas where there had previously been low support uptake from families. When it comes to challenges in diet and nutrition, some services have found recruitment difficult, which means that their supply can't always meet demands, with an impact on waiting lists. Some agencies also have received feedback that they don't always provide food which can respond to all dietary preferences and cultural requirements. And so that's something that we've seen services really work intentionally to address through their parental engagement and co-design processes, so that ABS is perceived to be inclusive of all families and reflective of the families that live in their local communities. In terms of communication and language, improved screening processes was a definite highlight in our data this year. So for example, the traffic light system introduced by the Welcome Screening tool had resulted in an increase in referrals for the very youngest children in an area. The impact of early support has meant that there's been a reduction in children being referred for more specialist clinical support later down the line. Peer support roles for speech and language has also meant that the speech, language, and communication triage panel has been able to make more informed decisions about a family's support needs because the level of intelligence the peer support worker has been able to provide. When it comes to challenges, COVID has continued to have an impact, and we're seeing that come through with long waiting lists for support, but then also high turnover of staff, meaning that new recruits are always in need of training. Regarding social and emotional development, Working together in partnership was seen as a particular success, as has been the use of gentle, jargon-free, non-judgmental, asset-based language with families. I do think it would be fair to say that social and emotional development services do tend to carry a bit more of a perceived stigma with some families than the other child level outcomes. So for example, there are families, we've heard reflections from interviewees about families who are comfortable talking about their child's speech and language support needs, but are less keen to acknowledge that they may need some support with gentle parenting. The fact that it is a less defined area of support also means that some parents are less aware of the nature of the support on offer, and services have to work harder to encourage families to engage in the first place. The complexity of the service offer and family support needs can mean that staff recruitment can also be difficult, and some support staff are having to travel long distances and almost piggyback off of other support offers to integrate the social and emotional development support into it into other services and locations where they know parents are already engaged. And the fourth outcome domain is systems change. And this is a challenging area to evaluate. And our interviewees also don't always have a common understanding of what is meant by systems change. Part of this is because systems change can mean a lot of things to a lot of people, but then in the context of A Better Start, which is a place-based approach, that it particularly means that systems change can take different meanings and result in different actions and interventions in the different partnership areas, depending on what the local system looks like there and where the sphere of influence of the delivery partners lies. Now, that said, working together in partnership has been seen as key in being able to achieve lasting and meaningful change in families' lives, enabling services to be delivered for the better. Leadership within the core ABS teams was also highlighted as a positive. In particular, an intentional lack of top-down leadership approaches, which is allowing services to be innovative and creative. And that's meant that services can be more effectively tailored to meet families' needs and offer multidisciplinary support. Although there were a few challenges mentioned around staff turnover and some non-ABS services perceiving A Better Start to be somewhat transient, which has been met with a reluctance to invest in working together, staff retention has also been raised as a challenge in achieving systems change. Where this is something that we're going to particularly explore moving forward as ABS grant funding is coming to an end, as we really want to understand the legacy of ABS and what the impact on the wider early years systems has been and will continue to be. The theory of change specifies mechanisms which are intended to be present within all ABS services, regardless of what the delivery is. And these are the features that are considered essential to success. They are adaptive design, test and learn, scale up and replication, and then having capacity, and then making sure that organizations are well equipped with capacity. So that has been seen. We have evidence of those mechanisms playing out in the different services across the partnership areas through ongoing learning from data and evidence, using data to understand the needs of families, and then experimental learning and service delivery, taking on board feedback from parents and carers as well as colleagues, being very intentional about sharing learning between services as well as partnerships and nationally, and then making sure that the workforce is continually upskilled to increase their capacity to deliver the highest quality, most current services. The parental engagement was explored in depth as the annual theme, excuse me. As a theme of Objective 2. And that's understood on a spectrum. So parental engagement is not just about co-design and co-delivery, but it's understood by partnerships as meaningful participation, as well as taking part in governance and co-delivery of programs. So many of the strategies that interviewees described and shared with us were aimed at promoting that meaningful participation. And where services had co-production practices in place, there was often a really strong focus on mutual benefit, where the service would be enhanced by the parents' involvement, and also parents gain transferable skills which have had benefits to their lives, such as them finding employment off the back of their involvement with ABS. And this diagram here shows the influence of parental engagement in services in different ways, starting with effective outreach, leading through to that meaningful engagement, enhanced quality and outcomes, which improves the reputation of services, then supporting that effective outreach as new parents come along and join in. So the next steps for Objective 2 include we have our biannual waves of data collection underway, and that with the ABS partnerships, and then our annual wave of data collection with non-ABS partnerships and the fund will take place later in the year. Every summer, we also do an annual program mapping activity, which we'll be using to build a typology of services to see how that's changed over time. And those findings will be reported in the final report in 2026. I'm now going to hand over to Janet to share some learnings from Objective 3. Oh, you're on mute, Janet.
Hello, everybody. I'll try again. Can you see my slides okay? Yeah, great. So yes, I'll tell you a bit about the work that University of Sussex, our team, have been doing for Objective 3. And our aim is to evidence the experience of families from diverse backgrounds, so mapping journeys through a better start. And our focus has really been on understanding what a better start means within the kind of big picture of family lives over time. And our work to date has really highlighted the importance of accounting for that wider context and accounting for time in understanding what ABS provision can offer. So it's long-term evaluation activity, working in depth with families and with a very carefully constructed sample. So we're working with 25 families, as Mary said, 5 in each area. We're not trying to be statistically representative, rather the sample is emblematic of the diversity of families who work with a better start. So families have been selected to include a variety of different characteristics and experiences, including having children of different ages and different levels of involvement with local provision. We're speaking to each family twice a year over a 4-year period, visiting once a year with a telephone catch-up 6 months later. And we've had excellent sample retention so far. So our last catch-up interviews still had 22 families involved. And we're replacing the sample each year. So we'll have actually 26 in our interviews this summer. We're using methods that are family-centered and family-friendly. So we interview the primary caregiver, but anyone in the household can take part. And we use participatory methods like photography and mapping to make it easy for young children or other family members to get involved. And that also helps us understand what matters in family lives from their point of view. Our first annual report highlighted that many families are living with complex and challenging circumstances, and that remains the case. Since then, the cost of living crisis has hit hard, and we see strong evidence of that across all 5 areas. ABS provision has a clear role in mitigating some of the harshest impacts of poverty and financial insecurity. While life is still difficult for many people that we've spoken to, we see how ABS resources have helped families to manage in very challenging contexts. That's evident across outcome domains, but I think can perhaps be seen most starkly in relation to food poverty and in access to affordable spaces where children and parents or carers can be warm and can be together with other families. We do see some evidence of barriers and challenges for some of the families that we speak to. Timing and travel issues come up and can make activities inaccessible, as this mother explains on the right-hand side. Confidence and awareness also pose barriers, and that's especially the case for the most vulnerable families in the sample. Conversely, there's a very clear role for one-to-one outreach for ABS workers going out to families and providing the support that's needed to bring them in to a wider range of activities. In our Wave 2 fieldwork, we made extra effort to hear from fathers. We conducted follow-up telephone interviews with resident fathers if they weren't present during the family visit. And the men that we spoke to highlighted a range of considerations, also often valuing outreach work that fit with their time commitments and their priorities. But we can also see an interesting challenge here, a question posed by one of the fathers we spoke to, who questioned the appeal and inclusivity of activities that were specifically branded as being for fathers. So that question of inclusivity is one that comes up in our data. In the latest annual report, we've borrowed a metaphor from a geographer called Sarah Marie Hall, who uses the idea of a tapestry of care to think about how different forms of support weave together in everyday family lives. We've applied this in thinking about ABS as a systemic approach to family support in complex environments. Many of the families we speak to have discussed the value of ABS in strengthening informal networks, tackling isolation and building friendships. You see that in the quote on the top right. And that's valuable for both parents and carers and children, perhaps especially in a post-COVID context. It also helps in forming more casual connections. So just having people to speak to on a day-to-day basis. But these networks also create opportunities for parents to share skills and experiences, empowering women, as the mother explains on the left. Her map, which is covered in gold stars to show what's positive in her life, demonstrates how she's been working with ABS to set up courses for women, enhancing English and sharing other skills. Our analysis also shows how a tapestry of support enables different routes to access in ways that are not always linear. So this example is from a family who came to the UK as refugees in 2019. At the time of our first interviews, they had very little engagement with any services, and they documented a variety of complex and intersecting challenges. At Wave 2, their situation was very different, vividly shown on the children's map. I think what's striking here is that several of the activities and services they were using had been recommended by their ABS outreach worker, but were run by other local providers. What made a difference for them was a holistic engagement within diverse local networks. So if we ask whether ABS worked for this family, I think we can say yes, but not in a narrow sense. It worked by drawing them into that tapestry. And here, in an interview with a mother in a different part of the country, we can see how systemic provision has created a pathway to specialist support. This isn't straightforward. The causal chain again relies on that tapestry of support and connection, which starts with a conversation with another parent. The importance of having multiple routes to support is also evident in this example, which moves from identification of concern through to specialist referral. There are multiple points at which the family can access expertise, and that's what's crucial in ensuring the child's needs are recognised and addressed. So you can see there's a sequence from the health visitor raising awareness, speaking to a speech and language therapist at one children's centre, which the family eventually stopped going to. But then because the mother's able to access that specialist support through ABS provision at a different centre, the child's needs are not missed and she's able to get to that point of specialist referral. Across the ABS outcome domains, we see common features in the kind of support that makes a difference, and there are real synergies with this and what Mary has described. So respectful engagement is key. Valuing parents' expertise, listening to their priorities and their concerns. That also means recognising that parents and carers are doing what they can, even when they're struggling or face significant intersecting challenges. So this second example goes back to those pressures of poverty. This mother clearly understands and values healthy eating for her family. It's the support of the Healthy Start vouchers that allows her to act on that. Otherwise, she'd struggle to meet her aspirations for her children's diet and nutrition. Parents and carers are clearly learning from their engagement with the Better Start activities, but again, relevance to their concerns and priorities is key. This example of managing a toddler's emotions illustrates that connection and shows the potential for change in that area that Mary described as challenging because of fear of stigma. By supporting the family with an issue that they were struggling with, the ABS provision has given the mother a new understanding. It's helped her to adapt her own parenting practices and crucially helped her to instigate wider change in the family. And as she says, this has made a difference to everything. So finally, next steps. We've now completed our spring catch-up interviews and we're just about to start wave 3, our next phase of visits to families. As I said, we have 22 of the 25 families are still involved and we've added 4 new families to the sample. So we're expecting 26 interviews this summer. We're using similar methods, focusing in particular on areas of change and continuity, but also looking in particular at transitions. So the older children in our sample are now aging out of ABS, but we're also looking at transition as the 5 partnership areas are moving to the next stages of their work in terms of legacy planning. So thank you.
Thanks, Janet. Just give me a second to get my screen up here. Okay, so hopefully you should be able to see my slides now.
Not yet. Let me know if you need me to jump in, Beth.
Okay, have you got it now?
Yeah.
Good stuff.
Yep, all good.
Great, thank you so much. Thanks, Janet. It's always really interesting to see the photos and hear the voices of the parents coming through in your work. I always enjoy that bit. So I'm here to talk about Objective 4. The aim of Objective 4 is to evidence the contribution that the programme's made to reducing public sector costs as they relate to primary school age children. And to do this, we need to understand the delivery costs, the outputs delivered, the change in outcomes, any resulting change in public sector activities, and then finally, how that changes public sector spend on each child between the ages of 5 and 11. And we're doing this by using a cost consequence analysis approach, or CCA. And it's been recommended for complex interventions like ABS because it captures a greater range of outcomes, and it doesn't attempt to aggregate findings into a single metric. So the outputs from our analysis will be presented as disaggregated tables of costs and benefits, and some of those will be quantified and monetized, but it will also incorporate qualitative elements where it's not appropriate to monetize benefits or not possible. And this approach includes 5 consecutive work packages shown in this diagram. So we start by identifying and describing the costs associated with the programme, then identify and describe the short-term effects or the outputs from the programme. We then link in with Objectives 1 and 2, which is about identifying and describing the associated outcomes from the programmes. And then work package 4 is to identify and describe how those change in ABS outcomes will impact public sector activity and spending. And then finally, in the 5th work package, we put all that together to assess the cost effectiveness at a programme level. So firstly, looking at the programme costs. So delivering the ABS programme incurs costs across several different several different areas. The first is the ABS grant spend, which is given to each of the 5 partnerships. And that covers project spend and also the portfolio management costs at the partnership level. And that obviously makes up the bulk of the programme spend. Then we have the central programme costs. So that's the time and the expenses for the staff at the fund who are responsible for management and oversight of the programme. Then we also have a package of support and delivery activity costs. So that's things like the development grants that were paid to the partnerships to develop their ABS proposals. It also includes things like contracts for communication campaigns, evaluation and learning. And then finally, we have the leverage funding. So that is non-ABS grants or funding or donations that have been allocated to support ABS activity at the partnership level. It also includes any non-monetary commitments from partners, and that might be by providing services or facilities to ABS beneficiaries or activity or ABS services on a free or a reduced fee basis. And as of the end of March 2023, that all totaled up to £199 million. An analysis of that programme spend by financial year shows that the programme spend grew slowly during that initial test and learn cycle from 2015 to 2018, and that most of the programme spend has occurred between April 2018 to March 2023. And actually, I should say March 2023 is as far as our analysis goes at this point. We're still waiting on the data from March 2024 and beyond. That'll be included in next year's report. During 2023, we also continued to work with 5 partnerships to update their spend to outcome mapping as far as possible. In addition to the outcome measures on which the national evaluation is focusing, so the ones that Ennis was discussing earlier, the partnerships mapped their spend to a category of what we are describing as other outcomes. Those included some of the ABS Common Outcome Framework measures that aren't selected for the national evaluation, as well as partnership-specific outcomes that are related to children and maternal health and well-being. And the bubble diagrams presented on the next few slides show how each partnership has mapped its grant spending to each of the ABS and other outcome measures. Any remaining unmapped spend for each partnership, so spend that they couldn't allocate to a specific outcome or which covered multiple outcomes, or all outcomes, sorry, has been allocated to the outcome measures proportionally based on how they originally mapped their mapped spend on a pro rata basis. This includes any project or leverage spend, portfolio management spend, central program spend, and support and delivery spend. So looking at the analysis of the spend per outcome showed that for Blackpool, the largest proportion of its spend was allocated to achieving systems change, with at least some of the spend from 25 different projects being mapped to that outcome. For Bradford, the largest proportion of project spend was allocated to perinatal maternal mental health, depression and anxiety, with at least some spend from 9 different projects being mapped to that outcome. And the second largest proportion of Bradford's project spend was allocated to communication, with 7 projects contributing some spend to that outcome. Lambeth allocated most of their project spend to what we've termed other outcomes, and that included things like social capital, breastfeeding and preterm birth, as well as improved parental mental health and well-being, secure attachment to a trusted caregiver, improved maternal physical health and nutrition, more families having strong support networks, children having a BMI that's neither high nor low, and more survivors of domestic abuse accessing appropriate specialist support. The second largest proportion of Lambeth's project spend was allocated to child development at aged 2 to 2.5. For Nottingham, the largest proportion of project spend was allocated to achieving systems change, and there were 13 different projects allocating some spend to that outcome, with the second largest proportion of Nottingham's project spend being allocated to school readiness, and there were 3 projects contributing to that outcome. The largest proportions of Southend spends were allocated to perinatal mental health, depression and anxiety, and communication. But there were also fairly large proportions of spend allocated to systems change and breastfeeding at 6 to 8 weeks. So what we can see across these 5 slides is that there's considerable variation in the profile of spend across each of the 5 partnerships in terms of the outcomes that they've directed most of their money towards. And that's in response to their local needs. That's the purpose of the place-based evaluation. During 2023, we've also conducted an analysis of cost per unique beneficiary. And this is based on monitoring data on the number of unique primary beneficiaries who were reported by the partnerships to the fund. Before I go into detail on what this slide shows, it's worth just highlighting some of the limitations to interpreting these findings. Firstly, the partnerships collect data from different sources for unique beneficiaries. So some locally commissioned services may have different data collection processes compared to centrally commissioned services. And that means that some of the difference is in the numbers of unique beneficiaries across services and partnerships may not be entirely attributed to uptake. The second thing to note is that the degree of resource requirement, engagement, quality, and experience differ across services. So, for example, some ABS funded services offer very intensive, bespoke support to a small number of families with acute needs, whereas other ABS funded services offer less resource intensive, more universal provision to the entire population. And that nuance is going to be lost when we're looking at this partnership level unique primary beneficiary data, where any participant from any ABS service is counted as one unique primary beneficiary. Then thirdly, any beneficiaries who access more than one service within the same year will only be counted once. So even if they've accessed 5 different services, they're one unique primary beneficiary. Whereas if the beneficiary has accessed support in more than 1 year, they'll be counted in each year they access that support, regardless how many services they've used in any given year. So that means the cost per beneficiary analysis presented here should be used to inform the overall picture of implementation rather than for assessing performance of the ABS programme or of individual partnerships. So now that I've given you all my caveats, what this analysis does show you is that there has been much variation in the average spend per unique primary beneficiary over time. So in the first 3 years of the programme, during the setup and the test and learn cycle, you can see that the average cost per beneficiary was relatively high. And this was particularly true in Blackpool and Lambeth, where there was significant spending upfront in Blackpool portfolio management and in Lambeth capital projects, which were in both of those cases were higher than the other partnerships during that time. And that's reflected in the higher spend per unique primary beneficiary at the beginning. But what you can see from this chart is as the programme has developed and become more established in each of the 5 areas, the participant numbers have increased. The average spend per unique primary beneficiary has dropped considerably. And you can see that from about April 2019 onwards, the average cost per unique primary beneficiary has been relatively stable for each of the partnerships. Our analysis of the reach across each of the partnerships, so this is looking at the number of unique primary beneficiaries accessed as a proportion of the eligible population, shows that the reach of all partnerships increased over time as they become more established, and that's particularly from the 4th year onwards. So following that initial test and learn cycle, each of the partnerships has become much more established within their areas. Analysis by the type of beneficiary, so looking at the proportion of the pregnant population that's been reached or the proportion of the population aged 0 to 3, shows that the programme has reached higher proportions of eligible children than eligible pregnant population for all partnerships except for Lambeth. For Lambeth, the reverse was true. On average, between 2018 and 2023, when the programme has been fully established and up and running, around a quarter of the eligible pregnant population has been reached across the 5 sites, compared to more than 2/3 of the eligible 0 to 3-year-old population. However, as I say, that has varied by partnership, and Lambeth, unlike the other 4 partnerships, has reached a higher proportion of their eligible pregnant population compared to their eligible 0 to 3-year-olds. And just finally then, the next steps for Objective 4 are to build on the analysis of the costs and the monitoring information that I've presented here today, and updating those figures annually for the remainder of the evaluation. Calculation of the benefits of ABS, as I said, will be based on the evidence collected through Objectives 1 and 2, discussed earlier. And over the last year, we have also been undertaking a review of existing economic studies on the impact of early years interventions on public sector spending during those children's primary school years. And we'll supplement gaps in that existing evidence base with a series of interviews as part of Objective 2 over the next couple of waves. And that's to explore how a change in outcome will impact public sector activity in terms of time and resources. And then we'll bring all of that together to assess the cost effectiveness of the programme. Thank you very much. I will try to stop sharing now, Mary. Sorry, Mary, I think you're still on mute.
Yes.
Thank you. Yeah, thank you, everybody. I really enjoyed listening to those presentations, and I hope that you did as well. I'm afraid we're quite short on time, so we don't have much in the way of discussion, but we have had some questions come in about the types of services that are being offered through systems change. And we're collecting that data through the activity mapping, but we haven't done the full analysis yet to present a typology of services within each outcome domain and how they change over time. But that is something that will be coming through the Objective 2 work as the evaluation progresses. And I would also recommend having a read of the first local evidence synthesis, and we'll send links around to all of that, which explores which explores implementation within the outcomes on the from the local evaluation evidence. We also had a question come through about the contribution analysis, and we are using principles of contribution analysis to really unpick the mechanisms at play within services to be able to understand the impact of ABS in a very nuanced way and what that means for the partnerships and for within each outcome. And the annual report that we just published shows the beginning of that analysis, where we map evidence that's being generated against the contribution statements that provide a narrative to the theory of change. I see some more questions and reflections coming through. We will review them and circulate a response along with links to these resources after the webinar is over. So thank you so much for sharing those. And just to remind everyone to look to the further reading and listen to our podcast, where you can hear more about the evaluation, the challenges and successes in how we're learning about a better start. And I'm just going to close there and want to again thank everyone for joining us, and also to the panelists for being so generous with their insights about their objectives. And we will be sharing a recording of the webinar that will be live on NatSend's YouTube channel.